All right, let's get started. Hello, everyone. Thank you for joining us in another video. In this video today, we will be discussing oral health versus neurodegeneration. I'm going to explain the paper in a bit, but just to preface this, let's begin by talking about how for years scientists saw oral health and brain health as two totally separate things, right? New evidence, however, shows that diseases in your mouth, especially gum disease, might quietly raise the risk of brain diseases like Alzheimer's, Parkinson's, and possibly multiple sclerosis or MS. So this video is basically break down a recent review paper that explains why taking care of your teeth could be surprisingly important for protecting your brain as you age. All right, so as we know, oral health is viewed as not related to neurodegenerative disease, but gum disease has been linked to bacterial spread, immune changes, and most importantly, inflammation. And these issues can lead to problems with Alzheimer's disease or gaining Alzheimer's disease, Parkinson's disease, and MS or multiple sclerosis. So just imagine your gums are bleeding every time you chew food or brush your teeth. Bacteria and inflammatory molecules can slip into your bloodstream. You might want to know. You have to take care of your teeth. Bleeding gums are usually caused by the buildup of inflammation over years because you're not brushing your teeth, you're not flossing correctly, and this basically would what when this inflammation is accumulated for such a long period, the protective seal that is on your gum lining can open, and an entryway for bacteria can infiltrate your bloodstream and eventually get into your bloodstream and and that can lead to cardiovascular issues due to bacteria latching onto the fatty plaque of the arteries, and this can cause more buildup and increases chance of heart attack, blood clots, stroke. This can lead to problems with your gut health as well as heart valve infections, and overall systemic inflammation. Systemic inflammation. The systemic inflammation can be caused by your liver producing this protein known as C-reactive protein, which is a big inflammatory marker for if the body is detecting a lot of bacterial infections within the body. The C-reactive protein is released to help with inflammation. But if this inflammation increases, you can only imagine that it will eventually reach your brain. So that sentence, the end of the sentence where it says bloodstream every time you chew food or brush your teeth, sometimes when you have these entryway already opened and you, for example, you begin to start brushing your teeth. Whenever you brush, you're you're putting the bacteria that's sometimes located on your brush or on your teeth, and you're putting it further into the opening, and then it allows the bacteria to get inside. So that's why it's very important for you to also floss after you brush your teeth. It's just a little takeaway from that. So the scientists are now asking, could these bacteria eventually reach and affect your brain? Right. So the evidence isn't 100% proven yet, but it's getting harder to ignore. So let's talk about the paper. So this paper is called The Association Between Oral Diseases and Neurodegenerative Disorders. So it's a meta-analysis written by Lorena Soini Emi and Solje Arja and Kula. This was published in Sage Journals in 2024, November 11th. So it's a meta-analysis. Authors, they basically looked at papers that were published between 2018 and 2022. They looked at links between oral diseases and neurodegenerative disorders, and they found that the biggest risk factor that predicted neurodegenerative disorders in the future was periodontitis, I should say. So this was a brand new experiment. They looked at the papers and they searched major databases and looked for clear patterns. And periodontitis was the strongest link to degenerative diseases, specifically Alzheimer's disease. But what is periodontitis? So periodontitis is a serious gum disease. It happens when bacteria builds up around your teeth and cause long-term inflammation, bleeding gums, bone loss around the teeth, and eventually tooth loss. Millions of adults have it, especially as they get older. So it's very important to brush your teeth. So what does all this have to do with the brain, right? So we have chronic inflammation, as I was talking about earlier. If you have the liver producing this protein, this C-reactive protein, you're going to be having a lot of inflammatory markers circulating around the body, and that can lead to chronic inflammation, especially if it's not dealt with. When gum disease lasts for years, inflammation chemicals stay high in your body. This can travel through blood and increase inflammation in the brain, which is a major part of Alzheimer's disease. Bacteria reaching the brain, so some mouth bacteria can escape into your bloodstream. Scientists have found pieces of these bacteria in brain tissue on Alzheimer's disease on Alzheimer's disease patients. The most specific bacteria that's been found is called Porphyromonas gingivalis. Lab studies link it to more brain inflammation and amyloid buildup. Although this isn't proof it causes Alzheimer's, just that there's a possible connection. Oral brain axis. So think of the gut brain axis. Scientists now talk about an oral brain axis. Two, the microbes in your mouth can influence your immune system, inflammation levels, blood vessels, and even brain function over time. So the changes in the oral microbiome can influence the chances of getting neurodegenerative pathophysiological processes over time. Something to think about. So it's so the gut brain axis was just introduced a couple of years ago, and now we have this new idea of the oral brain axis. It kind of just talks to the school of understanding that most things inside your body are connected, very much connected, and it is important to try to maintain them as much as possible in order to reduce something that could eventually cause you problems in the future. So maintenance is what people who are maybe in their 20s and 30s should be focused on, maintaining their bodies so that they kind of reduce the chances of them having further problems in the future. And then that leads us perfectly to what the next slide will be, and that's aging. Why it matters most to older adults, right? The connection is strongest in older people because aging already brings higher risk of memory problems, a weaker immune system, more inflammation, and often worse oral health. And when this risk combined, the effect can be bigger. But we have to clarify exactly what's the main takeaway from this. Is this like everybody's doomed? Whenever you have bad teeth, does that equal AD? Not necessarily. The paper does not say gum disease causes Alzheimer's. It says gum disease may be a contributing factor, a risk amplifier, and one piece of a much larger puzzle. Alzheimer's disease involves genes, age, cardiovascular health, metabolism, and lifestyle. That's what we know. But based on the authors, the most practical takeaway is you have to brush twice daily, you have to floss regularly, treat gum disease early, get routine dental checkups, and reduce chronic inflammation by all means. That's the most important takeaway there. So for decades, we thought the mouth and brain were completely separate. Emerging research shows that they may be more connected than we ever realized. So while gum disease doesn't directly cause Alzheimer's, the evidence keeps growing that what happens in your mouth doesn't stay in your mouth. Taking care of your teeth might do much more than keep your smile looking good. It could help protect your brain for years to come. So please like and subscribe if you want more science explained simply. And tell me in the comments, do you floss daily? See you in the next video.